Now, this is the worst blood shortage in over a decade, posing a concerning risk to patient care. Amid this crisis, doctors have been forced to make difficult decisions about who receives blood transfusions and who will need to wait until more products become available. So what can be done and what should we know? Well, Dr. Glenn Ramsey, chair of the College of American Pathologists Transfusion Committee, is joining us with more. Good morning, Glenn. We have a question here. With the current blood shortage, can you touch on the recent changes in blood donation restrictions and who can and can't donate blood?
Good morning, Anna. Thanks very much. With the current shortage that we have, it's important to know when you can donate. Be at least 16 years of age, at least 110 pounds, and feeling well and healthy that day you go in. You'll be asked questions about whether it's safe for you to donate and whether it's safe for folks to receive your blood. There have been some deferrals that have been changed so that some people will find that they are eligible now that they weren't eligible before. For example, if you were over in Europe for a while and you were deferred because of that, you're probably eligible to donate now.
So what would you say to the public about the importance of donating blood, and why does it seem there's always a shortage?
Well, someone needs blood out there in the United States. Every 2 seconds there's a transfusion. It's incredible. But only about 3% of eligible donors actually donate. And to compound that, some of our blood components are only good for a few days on the shelf after we collect them. So we always need a constant supply of blood for our patients. And if there's an interruption, it really disrupts patient care.
Speaking of disruptions there, I know we don't want to have to talk about this, but we do have to ask what happens during a mass casualty situation, and how fast can that drain a hospital's blood supply?
Well, you've heard about you remember the Las Vegas shooting 5 years ago this month, where over 500 blood transfusions were needed right away to save many of those patients. So this is an example of how blood was on the shelf already and ready to go for a moment that we didn't know was coming. And so that's one aspect of this, is to have blood available for emergencies like that.
And what are maybe some of the other common incidents in which blood donation is actually needed?
Well, some patients need blood on a one-time basis for surgery or a car accident or other trauma. Other patients need an ongoing, lifelong transfusions, like sickle cell disease patients sometimes, or patients with blood diseases, or with undergoing cancer, chemotherapy, and so forth. So there are a number of different settings for patients to need blood.
All right, well, this is the important question. Where can we go for more information and an update on how we can donate?
You can go, for one place, to aabb.org to find out where you can donate and answer questions about your eligibility.
Well, Dr. Glenn Ramsey, thank you so much for joining us this morning and telling us all about blood donation. I hope a lot of people are inspired to go ahead and donate if they can.